Hey everyone, I am honoured to have Nat Kringudis, who is a qualified healthcare doctor, author, speaker, and all-round natural fertility expert. She's actually the founder of Melbourne Women's Health Clinic, the Pagoda Tree, creator of Yo Nuts, and producer of Health Talks TV, and most recently, 2 times best-selling author with her book, Beautiful You. Nat teaches us that being fertile can actually improve your general health and well-being, and this is of course a big part of maintaining more energy and stamina in busy life, as we know. Today we will cover how being fertile, but not necessarily in relation to having a baby, and listening to your body is key to preventing and healing deeper health issues to do with thyroid, adrenals, and energy function. So a big welcome to you, Nat. Thank you for being with us.
Thank you so much for having me. It's definitely a pleasure to be here and part of it all.
Excellent, excellent. Well, let's dive straight into it. We've got a lot to cover today. So firstly, I'm going to ask you, what is the connection between someone feeling burnt out to their menstrual cycle?
Yeah, I mean, what I think the 101 that we have to remember when it comes to our hormones is that they're always working in a way to try and balance you out as a person in every waking minute of the day. But to do that, especially in times of stress or burnout, the priority of certain hormones changes. So this is when we can say pretty much that your stress hormones will behave or impact your sex hormones. And that gets confusing because they both sound the same after a while if you say those two over and over and over again.
Sure.
Stress hormones, sex hormones, but
Yes.
basically that your stress hormones will be the priority, and your sex hormones then try and work in and around what's going on. And I think if we want to be more specific, cortisol, which is one of the main stress hormones that I'm sure we've spoken about a lot and we understand is a stress hormone, really pulls rank over your sex hormones, and that can show up in a magnitude of ways, especially when we are burnt out. But I think the most obvious thing that tends to happen is we can see it really disrupt the menstrual cycles, so we can start to see longer cycles or missing periods.
Right.
As a means of for women. For men, it tends to show up more with the emotional changes, anxiety and depression and insomnia and those sorts of symptoms. So it's not just specific to women. Stress, as you know, impacts all of us in some way. But when it comes to our hormones, it really pulls the handbrake as a coping mechanism, because in every waking moment of every single day, as a woman, up until you go through menopause, your body is pretty much working towards getting you pregnant every single cycle. It's just what it's trying to do.
Sure.
Now, if you are highly stressed, it's not an environment for fertility or pregnancy. So as you can see, when your body actually, as a coping mechanism, starts to pull the handbrake on your sex hormones, it's actually still working for you in trying to gear you towards pregnancy in an optimal situation. And we can start to appreciate that, I think, rather than looking and saying, why is my body doing this? Something's wrong. It's not working. We can start to appreciate it's doing exactly what it's supposed to do under those circumstances.
Right. And then that's interesting to note that as well, that the cortisol and the stress hormones take over. So the others are kind of getting pushed to the side. That makes a lot of sense now why people may be struggling with keeping that in check if they are stressed. And you mentioned as well, when we were speaking previously, that young girls are experiencing problems with their thyroid and menstrual cycle younger and younger. Is this getting more prevalent, and why is this happening, do you think? Is it because of stress?
Yeah, I think first of all, let's establish what stress is. Stress isn't just being busy or overworked. However, it is part of that too. And the amount of pressure and load that we put on ourselves in modern living definitely plays a part. I will see patients in the clinic that work full-time and study full-time. It's like, you don't have the capacity to do anything else. Like that's really, when you think about it. And then especially if you're a mother, or even just looking after yourself under those circumstances is a lot. So yes, stress is the pressure that we put on ourselves, but stress is also our environment, the chemicals in our environment, the toxins in our environment, the quality of our air, the water. It might be an internal environment, when I say external, being outside of the walls, but then also inside your home. It might be your office, the air. There's factors there, paint, chemicals in paints. Like there's so many external influences. So we've got these external stresses, we've got these external influences by ways of chemicals and toxins. And then we've got internal stress. So how well is your body working? How well is your liver working? How well is your thyroid working? How well is, are your organ systems working?
Sure.
And when they're not working properly, then they fail to support our hormones properly as well, or in a way that's conducive with health. And then we've also got our mental and emotional environment. So I would say that there's, these key areas that, and nutrition, sorry, is the other thing that I failed to mention, is another stressor. So all of a sudden, you've got a lot of little stresses that all weigh in. And it's just a matter of how many of those are actually turned on right now. How many of those are actually impacting your way of operation that might be showing up as, various symptoms. So yes, stress on various levels impacts the way that your body will work. Now I got sidetracked. What was the question?
About the younger girls. You're noticing
the younger girls, yes.
Females actually with these problems now.
Yes, so I think this is really interesting, and it's only really been since I wrote Beautiful You, which was targeted at young women, that I've had the opportunity of seeing more of this in clinic, where young girls are presenting earlier and earlier with their period. When I was growing up, 13 was the average age. I'm 42. And that was definitely an average age. But as time's gone on, 11 now we say is around an average age for girls to start to menstruate. And that would be considered normal. And if you ask me why I think it's earlier, I think it's particularly environmental stresses that have weighed in, as well as stresses as a mother whilst you were pregnant, and early childhood stress as well.
Wow.
I think that these factors are really impacting the way the adrenals are working. There's evidence, or I've read research on mothers whilst pregnant. If they are under a lot of stress, it can actually, to help them cope with the stress, it can actually activate the adrenals of the baby to help them cope. And I don't think there's enough research in this area yet to say that's a definite, thing, but I think there's something to be said about that. So, never before have we as women really worked like we work now through pregnancy. We really go hard to have that time off, or maybe some people don't even get time off. So I think that's a factor. I definitely think the environmental toxins, they mimic estrogen in our body. So our body doesn't know the difference between many conventional chemicals and estrogen. And so when we keep adding to the estrogen pile internally, that can be a factor. And the thing that I am really seeing for young girls as well is, and this is in the case of precocious puberty or early puberty, I'm seeing far more early puberty, which is, can happen in as young as 2 and 3 year olds. They don't start menstruating at that time, but they start to show signs of the adrenals starting to work, whether they're growing usually pubic hair, underarm hair, and body odor are the first things that people will report. So, having this information and making sure it's not obviously something else, because there's other reasons that you can reach precocious puberty or reach early puberty that are often a little bit more serious and can be more to do with the pituitary and possible tumours. Once that's ruled out, in every case that I've seen in the clinic, that's been ruled out. They've basically been told to just ride it out, that they'll go through puberty a bit earlier, but it won't impact their life. But I'm also for looking at, why is that happening, and what can we do to help these young girls? Because if their adrenals and thyroid are being activated early, but it doesn't really give them a stable cycle, we need to treat that too. So there's lots of facets, but I definitely am seeing this, increased presentation in the clinic. And again, what I did fail to say, it's often, for what I've concluded is, it's often in these young girls after a period of high stress in their early years, whether that's been some type of trauma, whether it's physical, loss of a parent, something has activated that stress response, which has then therefore kicked the adrenals in early, and we're seeing this pattern of them transitioning early through puberty.
That's fascinating. And like you said, something that would be great to find out a little more on as well. So tell us then, what are some signs that your menstrual cycle may be out of whack when you do actually get that? Or if you are older as well.
It's not uncommon for young women to have irregular menstrual cycles. And I think we need to remember that we don't sexually mature with our hormones until we're around 21. So, things sort of can be a little bit unpredictable throughout those
Sure.
years. And it's often we panic too, as mothers, we often panic. Our daughter might be 16 or 17, their period cycles or menstrual cycles are not regular, and we can freak out. And then that can be actually a bit of a slippery slope, because before long you find your 17-year-old being prescribed the pill, and that doesn't actually fix it, but just is pretty much a Band-Aid solution. So I think understanding that, first and foremost, irregular cycles are definitely a symptom of hormone imbalance. However, that there are times where it's normal for that to happen, and especially in younger years, that's a normal time
Of course.
for us to see irregularities. But the funny thing about symptoms that indicate hormone imbalance, they're so wide and varied, but I guess the most common would be irregular menstrual patterns, heavy bleeding, pain, period pain or ovulation pain, acne, PMS or PMDD, or premenstrual tension or very severe premenstrual stress, headaches, weight gain, anxiety, depression, like the list goes on and on and on, insomnia.
Sure.
I think what we probably associate with hormones, and we've all probably blamed it on our hormones as women, or somebody has said to us, you're just hormonal,
right?
Is we associate it with feeling not right, feeling a little bit emotional, feeling a little bit like I'm not living in my body, but someone else has hijacked me, or definitely those associated cyclic patterns that happen. But I think that's the key. Anything that happens cyclically, as a woman, you can probably fair to say it's sex hormone related, because our hormones, and as a woman, we are never the same on any given day of the cycle. Every single day of a cycle, we're different. Whereas men work on a 24-hour cycle. Every hour of every day, they're different, but it's, they just repeat the process every day.
Right.
Whereas we go through a cycle every month, or we should be. And so we're different every day, which can be really difficult. But if you can notice that your symptoms are cyclic, you get a headache every 2 weeks, let's say,
right,
or you get a headache once a month before your period, or you notice that you feel nauseous in the middle of your menstrual cycle, or whatever your symptoms, just track them and start to look and see if there's a pattern. And that's a cue or a key clue is what I'm trying to say, as to if it is actually related to your hormones or not.
Yeah. So while we're on that, is PMS a thing then? Is that a real thing?
Absolutely, PMS is a thing. Yes, because the reason being is that our progesterone levels more than likely are just falling short of what they need to maintain that cycle. And so if they are falling short, we can see the days in the lead up to the period for a lot of women being quite awful. Progesterone's a very calming hormone, makes us feel good, it helps us sleep. It's really important for it's a natural diuretic. It's important for fluid retention. And so again, like fluid retention towards the end of the menstrual cycle is common. Women go, I don't know why that happens. Well, more than likely is another clue. So your symptoms are always clues. It's just a matter of putting them all together and working out what they are. And I think that's where we make it all too hard, because we're like, oh, they're hormones, I don't understand them, it's all just too hard. But come back to what your body's telling you. Don't worry about anyone else's, and you can tend to then allow you to use that to really, get some answers.
Definitely. And that leads me then to asking you, are people less in tune with their bodies now because of busyness, or are we ignoring all of those clues that our bodies are giving us, do you think, and missing those early signs? Are you finding that people are less in tune? Have you noticed any changes over the past few years with increased stress and environmental factors, as we're talking about?
Yeah, it's a very good question. I actually think in my time in this industry now more than ever, people are more aware. I think in the past, there was definitely a period of time where women would say, I just don't even know what's wrong with me and I don't even know where to start. Or, I think the big challenge here is that if you are using some type of synthetic hormones, it can very much flatline your hormones and you actually don't know what you feel. And it's not to say that that's necessarily wrong. I'm not saying that you shouldn't be using contraception, but you need to understand the side effects of that. And very often women don't understand their bodies because they are medicated. But for those that aren't, or even for those that maybe are and just interested in watching their body rhythms, I think more and more women are curious and want to understand this. I know that when we were growing up, we just weren't taught it properly. We definitely weren't taught this in a way that was made a lot of sense. It was, you know, you have sex, you get pregnant, don't do that, basically. And whereas we know that it's, you know, we spend a majority of our life trying to not fall pregnant. And for a lot of women, when it's time to fall pregnant, they find out it's not as easy as they were led to believe. So it's about information. It's about asking questions. It's about collecting, you know, and really expanding your own knowledge bank to be able to understand your body better at the end of the day.
Yeah, certainly. And so then as well, going back to the adrenal connection here. So talking about adrenals, and we spoke about this on our very first chat about finding the core problem and working from there. So how is the adrenals the key then to healing our menstrual cycle and feeling better again and helping to balance out all the rest of the hormones?
I think in the West, we love to treat the symptom, right? We love to just go, I've got headaches, Panadol.
Have the Panadol, yeah.
You know, we don't look at why have I got a headache. And so I think really asking why always is very important. When it comes to hormone imbalance, especially sex hormones, so often the adrenals are right behind it, and that's the why. So working out if that's the why, and you have been under relentless stress for a very long time, you need to show the adrenals how to behave again. They will just respond to the environment that you're putting them in. And if that environment has enough of those stresses that we talked about at the beginning, then you're only ever, if you don't treat the reason, you're only ever going to be treating symptoms. And I say this to patients all the time. I can get them, you know, their cycles back. I can get them feeling good. But if we don't fix the core reason or the stress, and especially, you know, what's really hard is the emotional stress. That's the that's the bad boy in the room, right? You can change your environment. You can get rid of all your, you know, nasty cleaning products and replace them with greener products. You can change your makeup bag. You can, you know, that's not difficult. You can turn your Wi-Fi off at night. Little things like that can really add up. That's in that external environment. But the emotional environment and the emotional landscape is the hardest, and it's often the one that I'll say to patients, if we don't actually start on some level to treat that, you're only going to find yourself back here again in 3 months or 6 months, or when, you know, one wheel falls off, they all fall off. So, you know, because the adrenals are responsible for secreting the hormones that allow us to thrive through stress, we have to learn how to then therefore use stress as a superpower, because the moment that it starts to become problematic, it spills out to every area of our life. And I think that connection also between the adrenals and the thyroid is also really important to always understand. So often people present with symptoms that are thyroid related, or even their test results suggest that it's thyroid related, but the thyroid's still the symptom when the adrenals aren't working properly. The reason the thyroid's not working properly is because of the adrenals. So that's not always the case, but very often when we're talking about burnout, that relationship has to be discussed. And again, what do? We look at it in the West, we go, oh, your thyroid's not working, let's just medicate your thyroid. But if you're medicating and forcing the thyroid to do something, it doesn't have the capacity above the chain and below the chain in the sequence of what hormones need to work, then that's never going to be a long-term viable solution. So I think, you know, I'm all about long-term solutions. I want patients to be on the lowest to no dose of any medication or supplement without symptoms. So, you know, working out what that looks like for you is going to be different for everybody. And that's okay. You know, if you need to be medicated, but we can get you on a level that's lower, therefore less of a stress, because medications still pose a risk of stress as well. They still impact the gut. They still, you know, for a lot of people, they can be long-term side effects. We want you to be on a low to no dose with no symptoms always. I think that's something that is we should all have in our head as being the main aim.
Yeah, definitely. That's really great tips as well. Tell us, what is the best way then for young women to ensure they maintain a healthy hormonal menstrual cycle without having to go on the pill or to have these medications later on? What's something that firstly young women can do, and then afterwards we'll talk about older adults as well?
Yeah, so I mean, I think first and foremost, understanding your menstrual cycle is absolutely key, and having the gift of learning that from a young age, which we never had, right? No one ever really told me how to understand my cycle. So this starts by having conversations with our children. This starts from when they start to ask questions. We truthfully answer the questions, because also we do such a disservice to the next generation when we lie to them. And we do lie to them because we're embarrassed about saying, well, actually, mum's got eggs and dad's got sperm and they need to get together and that's how we make a baby, let's say, for example. But really being and having those age appropriate discussions, I think, is actually where it starts. That's how we change this for young women. So young women having that opportunity to really understand their hormones, to then also have the gift of, if I have symptoms, what is that telling me? If I have, and I would say for young women, probably three most common things: acne, period pain, or missing cycles. They're probably the three main things we see in teenagers that we will very quickly medicate and use the pill for. But if someone actually also did their, not practice, and I'm not really bad-mouthing doctors, but if you don't see the right doctor for the right problem, then you're going to basically end up with a prescription for the pill, unfortunately, especially if you're talking to your GP and hormones aren't their specialist area. For something like acne, how common it is for a woman to be handed a pill packet. But looking at why, because the problem is if she's got acne, more than likely she's got excess androgens or testosterone, which can be a very big clue into a condition known as PCOS, which we haven't really gone into here, but a lot of people understand polycystic ovarian syndrome or PCOS. So if you're missing that big clue as a 14 or 15-year-old and you're starting to medicate at that age, the long-term implications of that are that the day that you start taking the pill is the day that your hormones get halted. And when you come off the pill, say that's 10 years later, you are as sexually mature as a 14 or 15-year-old when you started taking it. So it's problematic. It doesn't fix the problem. It's different if you're using that for a contraception and knowing that there's side effects to that. That's a different choice. So I think looking at those key signs as teenagers, working out why, the longer you can wait to use contraceptive and hormone contraceptives, the better it will be on your body in the long run. I mean, I'm always going to advocate for not using them, but for whatever reason, if that's not the right choice for you, then you need to look at, all right, well, what's my ideal scenario? So really using your symptoms to treat the problem, to get the answers, because that's not going to change. That's your blueprint. That's your your genetics. But what will influence your genes are all those little stresses that we spoke about before. So it's a matter of them working out, all right, which one of these? I'm more sensitive, clearly. I have the predisposition for PCOS. I need to make sure I've got enough of those stresses turned off so that doesn't get activated for me, and then I'm not presenting with these symptoms. And so that's the case I would say for young women well into their 20s. They're the most common issues that we see. As we get older, I think we start to see patterns of infertility, which is a really blanket term, really, isn't it? It's like, why are you not able to fall pregnant? Is it that there is hormone imbalance? Is it that you've got a known reproductive issue? So that would probably be the most common thing we see as we get older. That and definitely PMS, as we spoke about before. I'd say that they're really common. And ovulation pain for women sort of 25 and over, that starts to become another really obvious symptom that you might have, that your hormones are imbalanced and that we need to do something. And then beyond that, transitioning through perimenopause and menopause can be problematic if our hormones have remained in balance all that time. So you're not just balancing your hormones for today, you're balancing your hormones for your future. And it's hard. That's hard, because I don't think 16-year-olds don't care about falling pregnant or transitioning through menopause, unless we talk about it more, unless your grandma actually does talk to you about her experience with menopause, or does talk to you about her experience with severe PMS or depression or whatever it is. Having the conversations, I think, again, makes these things just part of being a human being, and then it's not a bombshell when it happens.
So much, and so much more communication is needed as well. I think that's a big key here. I'd love to just step back for a second and ask you this. So when you were saying that, say, a 15-year-old is on the pill for 10 years and they stop at 25, and then all of a sudden they are then mature, how long does it take if they stop the pill to regulate back to their normal hormonal levels because they've been influenced by the pill for 10 years? Is that a problem? And is that something that we need to consider if, say, they were intending on having a child at 26, they come off it at 27? Is it a year to get back to normal? Like, what's that? Because it's so common with people to go through this.
Yeah, I think the biggest challenge with any medication, but especially the pill, is we don't know until you start to take it if it's problematic for you. We
Right.
don't know how your body's going to respond. And so we don't know what will happen when you transition off until we actually do that. So that's really difficult. I guess what weighs in is genetics again, is probably the most obvious thing. And so this is where the wisdom of asking your mother or your grandmother what her experience around her reproductive and sexual health were, so that you can have some clues for you if you're not quite there yet. I think the main thing, however, to say is that if you are taking the pill at 15 because you have symptoms, you need to treat the symptoms, because the symptoms aren't going to go away just because you've used the pill. It can be a short-term solution to give relief. If you are 15 and you have horrific periods and you are in bed for 3 days of a cycle, that makes sense to me to go, okay, this is awful. My child needs to function. I'm going to do this, but what's actually the problem here? And then treating that so that, again, we're not needing to use something that's problematic over time.
Yes.
And then come off at 25 only to find that the symptoms are not just what they were before, but there's a whole lot more because it never got addressed.
Wow.
And if that's just one or two symptoms, it's fair to say that if that's left untreated, by the time you come off, and you know what normally happens is symptoms start to creep in even if you are medicated. And so, you know, that's a clue as well.
Definitely.
Patients come in and say, my period pain's just as bad even though I'm on the pill. It's like, it's not even doing what you're taking it for. So we need to find other solutions. And that all these things are treatable. I think that's the other misconception, is that we've been told that as women, oh, I'm sorry, honey, you've got period pain. It's just part of being a woman. It's like, well, no, any pain's not right. Any imbalance is not right. You don't have to have that, so long as we can work out, again, what hacks we can bring in, and it's all those stresses that we talked about, what hacks we can bring in to get your body to work better.
Yeah, that makes a lot of sense. I love how you dig a bit deeper, because really that's the whole key, no matter what age you are, right? Is we've got to find the causes, identify these stress factors and minimize them to start getting progress that's actually long-term, like you said, and without these Band-Aid solutions. Tell us, Nat, what are 3 things then that you recommend, might be more than 3, that people do daily or weekly to remain just healthier within all of these body systems and help prevent burnout?
Yeah, I think, look, I think we accept that we need to eat well, we need to sleep well, we need to move well. That's not revolutionary. Like, we know that, right? I think, however, people will try and get away with, you know, they'll say, does it really matter that much what I eat, Nat? It's like, well, food's either going to take your body exactly where you want it to go or exactly where you don't want it to go. So to think that you can kind of go, oh, it doesn't really matter. Well, it really, really does matter. So, you know, that's a basic nutrition. That's 3 things, but let's put them into one category, right? I think secondly to that, then, our emotions, we have to work out if there is some type of emotional baggage, and we all have it, but some of us cope better and some of us cope, you know, and what that might be, and how do we move through that? What is it that we need to do to actually be able to manage that, but address it as well? And that's not necessarily something you can do yourself, and that's where enlisting in a professional can be really, really important. And the other thing I would say is become aware of where your stress lies, because I think what happens is when we're stressed, we just continue to behave stressed. It's not until we stop and ask ourselves, okay, I feel overwhelmed, I know I'm stressed, but what am I actually stressed about? And if you sat there and you wrote down on a piece of paper all of the worries or stresses or things that were on your mind or your to-dos, and you'd probably find that there's maybe 5 or 6 things there, even though it's in your mind, it feels like a gazillion things. You write it down, there's probably 5 or 6, and there's probably only one key stress, and the rest are actually things that you can let go of. So really learning to ask yourself, does this warrant this precious release of my cortisol to imbalance my hormones, as well, all those things we've just spoken about? Is that really necessary? Do I really need to do that? And I would say that there's at least 4 or 5 things that you're probably stressed or worried about that actually You don't even need to be. It's just a bad habit that you've created for yourself. So really
Yeah.
letting go of those stresses, I think, becomes another big factor that we have to be aware of, and we have to choose it, and no one's going to do that for us. We have to do that ourselves.
Yeah, yeah. So being accountable, that's fantastic. I love it. And it's kind of like forcing us to shift our perspective on things that we worry and we get overwhelmed about. But really, like you said, does it warrant, I love what you said, does it warrant your cortisol release to really be, like, we're not running from bears most of the time, you know,
No.
but of course there is genuine things that happen that cause us stress, absolutely. But a lot of that day-to-day stuff and that busyness that overrides us, yeah, we've got to just step back from that, hey?
Absolutely. And like I said,
Maintain
we
some
have to choose it.
Yeah, yeah, it's a choice. That's fantastic. I'd love to keep going with you today, Nat. This has been really informative. Would you like to add anything else to our amazing audience before you leave us for today?
Of course, yes. Thanks, Vanessa, so much again for having me. If you're
That's
sitting
okay.
here and you're wondering what the heck, I don't even know where to start with my hormones. I'm pretty sure we can include a link here to take you to I have a hormone worksheet, and it's the most common hormone imbalances. So there's 5 most common types. There are a few more, but it's the 5 most common types because we don't want to be overwhelmed. And so you can literally plug your symptoms in and work out which one that you are. And I think what that allows you to then do is start to become more curious as to what your symptoms mean, and then what you can start to do to address them. So we'll provide that link and people can check that out. And
what's your main website, Nat?
It's just natkringudis.com.
Great. We'll pop that up for everyone as well to connect with you. Thank you so much once again. It's been awesome. Really great knowledge here today.
Thank you.
All right.
No worries.
Speak to you
Take care.
soon.